Dr. Jane Townsend is the Chief Executive of the Homecare Association. She speaks for the agencies that send care workers into people's homes. And Anna Severwright helps lead a movement called Social Care Future. She uses a wheelchair. She relies on social care to live independently. And they were both consulted on this policy document, this white paper. Those three key aims then, how does that dream compare with the current reality? Anna Severwright, what do you think?
Good afternoon.
Hi.
So at the moment, I think what I hear most from people is that it's a fight to get care and support that they need. And due to the lack of funding that's currently out there, you have to reach quite a high criteria before you get any support. So there's quite a lot of people who don't even qualify at the moment. Or if you do get support, it often comes in too late when someone's already sort of hit a crisis point, and then there's no time to plan or have really genuine choice over where you live or what support you get. So we see for older people often having to go into residential care homes rather than being able to stay in their own home. And for working age adults, you're kept fed, safe and watered and washed, but you're not really supported to be able to live an ordinary life. And I think COVID showed us all how important those connections are with people and things we enjoy doing. And a lot of people are finding they're not able to do those things.
Jane Townsend, what do you think about how the current reality measures up to this aspiration spelled out in the white paper?
Unfortunately, we're a long way from that vision. Currently, demand for home-based support and care is outstripping supply. And at one level, that's positive because people recognise the value of being supported in their own home. Everyone wants to be in their own home and surrounded by people that are important to them and connected to their communities. But at the same time that demand is rising, recruitment and retention of care workers is harder than it's ever been. And that means that unmet need is high. It's always been quite high because, unfortunately, the government has cut funding to councils over many years, and that's led to rationing of care and poor approaches to the way that councils commission and purchase care. And that's then had a knock-on effect on terms and conditions for the workforce. So what we're seeing is the end result of years of poor policy and underinvestment.
Well, there seems to be wide agreement that there are some good ideas in this white paper. Anna, what is in there then that you really liked?
So I like the focus on people having choice and control over their lives and being able to live independently. All of those are really lovely words and words that have been around for quite a long time. So I think we need to see how they're going to be put in place, because it's all very well saying people have choice and control, but they need to actually have the options there. And I did also like the fact that housing was focused on, talking about adapting properties earlier, increasing disabled facility grants, things like that would actually enable people to be more independent and to be able to stay at home. And the look at innovation as well, looking at how we can do things differently using micro enterprises and things like that.
Jane Townsend, what did you like in it?
I like the emphasis on support at home and in the community. I like the acknowledgement that we need to shift from being very reactive and dealing with crises towards a more preventative approach. And as Anna has said, housing and different ways of delivering support are key to that. But I think maybe I'd like to focus on the technology proposals. And we have got quite a substantial amount of money, and NHSX, which is the part of the NHS focused on the digital agenda, has been working with the social care sector for quite some time, well before we started talking about the white paper. And the proposals are quite practical, so they've acknowledged that many care services don't even have access to Wi-Fi, and in the case of home care, mobile phone coverage isn't all that great, so we need to focus on infrastructure and being able to support care providers to move away from using paper to using digital records, which enables you to see what's going on in real time, which really helps to drive quality, and then also to encourage communication between different professionals. And it also talks about the potential for what they call care tech, but that's Internet of Things devices, remote health monitoring, to try to support people to look after themselves as much as possible, so that they don't need professional care workers, that they can manage themselves as much as possible.
Unpaid carers had a terrible time of it, didn't they, in the pandemic? And Norman Phillips rang a phone-in we did about that back in June 2020. He lives in Stevenage. He was looking after his mum at the time, who has dementia, and his wife, Rosie, who has multiple sclerosis and dementia. Here he is.
I did get some help from some counselling because I'd kind of reached the point of when is this going to end. I kind of felt like the paratroops on the Arnhem Bridge. I've been here 4 weeks. When's 34 coming?
Oh, yes.
And the honest answer is they ain't. People shielded like my Rosie, we're stuck for a year. And I mean, my head just thought, how am I going to cope for a year like this? It's just a nightmare.
We spoke to Norman again this morning. His mum died in May of this year. Rosie's been in and out of hospital. He's recently been diagnosed with cancer. He's being treated for cancer now. Anna, the white paper promises up to 25 million to provide more support to unpaid carers. Will that go very far?
No, I don't think it will go far at all. During the pandemic, we saw, I think, some of the stats are massive about, I think, somewhere about 6 million unpaid carers. And we saw an increase in that because a lot of people, some people shielded and so stopped their formal care and support. So families took over, or people's needs increased. So 25 million is just a drop in the ocean. And I don't see how that's going to actually provide genuine support to someone like Norman who needs some support there to stop him from needing care and support of his own, actually, if he's not supported.
Anna Severite from Social Care Future, Dr. Jane Townsend from the Homecare Association. Thank you both. You're listening to You and Yours. It's 25 minutes to 1.